G'day ladies and gentlemen, this is Landman from Key Wealth, and in this video we're going to have a quick look at the primary select option of 2025, which is no longer going to be available with Bonitas from next year in 2026. So what Bonitas has done is that the primary select option will now be converted into a BonPrime option, and this is a savings option with quite a generous 16% savings account, so that's not too bad, providing a single person 6,252 Rand of savings for the year, and there are some other benefits that are included in it. So all in all, not very bad, with a minor increase from almost 3,000 Rand per month to 3,255. Just take note that this option does make use of network hospitals, so be sure to check that the hospital that you're required to go to in case of an emergency or for a planned procedure is listed on BonPrime. Primary Select, which was a great affordable alternative for many people, will no longer be available anymore. But if you enjoy the benefit structure, you know how it works, and you want to continue with it, you can look into just changing your option to Bonitas Primary. It's basically exactly the same option. It also uses network hospitals, so make sure to check that it's that the hospital that of your preference is on the network list, so that there aren't any additional co-payments. And then this would be a little bit of a bigger jump for you, from 2,946 to 3,588, but you still have all of the great benefits, your GP visits, your medicine, everything included up to the overall annual limit, and then of course with your dentistry. So without further ado, let's dive into it a little bit deeper. So first, let's take a look at the Bonitas BonPrime option for 2026. Very important about this option will be replacing the Bonitas Primary Select option for 2026. So if you're on the Bonitas Primary Select option, this is what you will default to if you do not opt to go ahead with the Bonitas Primary option. So let's look at what you have. You have 325 Rand for the main member, 2,546 Rand for the adult dependent, and 1,035 Rand per child dependent. Just take note of this. There are specific private hospitals, so make sure that you are close to one of your network hospitals. So check in with us if you need that list of hospitals where you can go to. There's also a formulary applicable for chronic medication. You only pay for your first 3 children. Thereafter, the kids are free. And then dependents up to the age of 24 pay child rate. So that's very nice. If you've got a child in the house that's 22 or 23 years old, they can actually still qualify for child rates, which is fantastic. So out of hospital, there's quite a lot of savings because this is a 16% savings account. 16% of the premium is allocated towards your medical scheme savings account. You've got 6,200 Rand for the main member, there's 4,800 Rand for the adult dependent, and just under 2,000 Rand per child. Important here is that everybody can use everybody's savings. So if there's a main member and adult dependent, you'll have a little bit over 10,000 Rand, and only the adult dependent or the main member, or however combination of that, they can use the money. It's a first come first serve basis. So I'm going to run through this very quickly. Everything is basically paid from your savings account. So you've got GP consultations, that's paid from your savings, your specialist consultations, but do note you have to get a referral from your GP. All non-surgical procedures. You do get 2 emergency room visits at a casualty. That's very nice. But important with this, there's some rules that go hand in hand with it. So I always recommend to take out a solid gap cover. If you've got a good gap cover, then everybody's covered in the emergency room, regardless of whether Bonitas pays or do not pay. And then with gap covers, kids are, depending on the gap cover, kids are automatically included up to a higher age than 6, depending on the gap cover. So that's also very, very cool. And then everything else is paid from savings. I'm not going to go through it individually. You can pause the video to have a look at that. But you do get an eye test, which is not paid from your savings account, and then also some of your the lenses for the glasses. It's not paid from your savings account, but your frame is paid from your savings account. So just take note of that. So if you have a pair of glasses, you can go and get your eyes tested and replace the lenses, but the frame will be for your own pocket. Okay, everything else is also paid. So again, you can pause the video here and have a look at what's paid from the savings account, or how does it work. Important things to note here is that your MRI and CT scan benefit out of hospital is quite low, just under 4,000 Rand for out of hospital scans, and then you also have a 2,240 Rand co-payment, so not much of a benefit there, so just be aware of that. Again, this is something that can be the limitations on this option can be breached with a good gap cover. So gap covers sometimes increase the amount available for a scan, and they also pay your co-payment for it. So very important if you're on this option to take out a good gap cover. Please reach out and let us assist you with that. And then there's a lot of rules linked to the dentistry benefit, so make sure that you study this hard and know what you can do and cannot do, although everything is paid from your savings account. So just be aware of how it works, but you have to adhere to the rules. So just take note of that. Then they do pay for those fissure sealants for the kids. That's a very cool thing. That's not paid from savings. That's a preventative benefit. And I think they do pay for a consultation as well. But in any case, all right, let's continue. Specialized dentistry, all of this, very important. It is from savings, again, with rules linked to it. And then all right, specialized dentistry, again, it's mainly funded from savings. I'm not going to go into detail in how this works. You can have a look at it, but it is important to know that your dentistry, there's no hospitalization for dentistry unless it's a PMB. So that's a very important thing to take note of. You cannot go for an extraction, for example, in hospital unless it is very serious. All the normal chronic conditions are listed under this option, so that's very cool. But what's nice about Bonitas is they always do have a good mental health benefit. So depression medicine is also covered up to 165 Rand per beneficiary. So obviously, like I mentioned in the beginning of this video, there's a formulary link to it. So you won't be able to take out anything, but it's a good benefit to have nonetheless. And then this is some of the more exciting stuff for next year. So the benefit booster, they've increased that to 4,000 Rand. Now, what's cool is you go and you do your health assessment, your wellness screening at any pharmacy that's got an agreement with Bonitas. So that's very, very easy to do. This year in 2025, there were levels. Next year, you do that and you're done. So that's great. You can use this for all of your day-to-day benefits. So if you're a single person on this, you get over 6,000 Rands savings. Once that's depleted, you can activate this for an extra 4,000 Rand of benefit booster. And I mean, that gives you over 10,000 Rands worth of day-to-day, which I don't think is too bad. Bonitas does offer some additional benefits. So on the mother and child side, I'm not going to go into detail of this, but there is a maternity benefit, so that's kind of nice. Your child care benefit, so that's when a baby's born on this program. There's also a maternity program where they give you medical advice, or they assist you, or you can be in contact with them. Some nice things like a baby bag and weekly engagements if there's a high-risk pregnancy, post-childbirth follow-up calls and things like that. So overall, if you are looking at starting a family, the antenatal visits is not that much. So, but some of the other schemes give you 8 or 9, sometimes 12. But it is decent enough to have a baby on this BonPrime. There's a lot of preventative care benefits, so that's very, very cool. You can have a look at this, but it's HIV counseling, flu vaccines. If you're older than 40 and a lady, you can have a mammogram once every 2 years, and it goes on. So that's also kind of good. Okay, so let's have a chat at the in-hospital benefits. You can pause the video here and have a look at how it works specifically, but basically it's 100% option. That means that you do need a gap cover if doctors are going to charge more. So have a chat with us so that we can assist you with that. Everything in hospital is covered at scheme rates, or that's the 100% Bonitas rate. You can have a look at this. Your MRI and CT scans in hospital, 15,960 Rand per family. Again, a gap cover would increase that limit for you. And again, there's a co-payment which a gap cover can pay if you belong to a decent one. Always make sure to use the designated service provider, the DSP. So for cataract surgeries, make double sure that you've got it. Important that there's no physio and things like that in hospital, so it's subject to your savings. You can see here all these allied, so dietitians, physios, things like that. They're not fond of paying it on this option, so that won't be covered, or it would come out of your savings unless it's a PMB. So that would be for very specific cases. Another thing here, your internal prosthesis, PMB only. So your internal prosthesis, like a hip replacement, a joint replacement, a pacemaker for your heart, any device that's inserted into your body would only be for life-threatening cases, or the use where you can lose the use of a limb or something like that. For mental health, you can be admitted to a facility if it's required. And very important again to use the right network, otherwise there can be a co-payment. Okay, Bonitas has a 30% co-payment if you don't use the designated service provider for cancer. And then if it's a PMB cancer, there's an unlimited benefit. If it's not a PMB cancer, there's a 224,000 Rand benefit for it. So important. Over that, there's a co-payment of 20%. All of these, the PET scans and organ transplants, where it says PMB, that means it's for life-threatening situations, basically. And then here are your co-payments on this option. You can pause here and read about that. If it's a procedure that you need to go for or might have to go for, if it's important for you to not have a co-payment, very important, once again, make sure that you've got a gap cover. They've reduced the international travel benefit from 2.5 million Rand to 1.2 million, but it is still, the cover is still there. So if you are planning on traveling, then you still have some cover available. Next up, let's take a look at Bonitas Primary for 2026. And this would be the only one that's going forward into next year, as the Primary Select option has been discontinued. Now, it's going to be a hot topic for 2026 because the Primary Select option is falling away, and it was a preferred choice for many of our clients because of its great benefits and the affordability. So if you enjoy the benefit structure of the Primary Select option, this might just be for you, because it's basically the same option. It's a little bit better, but it's basically the same. It's got a larger hospital network, which is great, but the premium is increased a little bit from what you are used to pay, what you are used to pay, to what the premiums are going to be for next year. So here's the premium: 3,588 Rand for a principal member, 2,807 for the adult dependents, and then 1,141 Rand per child. Important. So hospital network, so make sure that you've got the right hospital at hand and you always go there so that you don't have any unnecessary co-payments. And then there's formularies applicable for chronic medicine. You pay for 3 kids, and the kids stay kids up to the age of 24. So if you've got a 21, 22, 23-year-old living with you at home, they're still studying or just started a job, or they haven't left the nest yet, don't worry, you can get them on Bonitas Primary at child rates up to the age of 24. Okay, so let's stop here. Out of hospital benefits. Depending on your family size, this is what you would get. So common one on this option, family of 4, husband, wife and 2 kids, you'll have 11,080 Rand for the year. And this is your overall limit. So just know that they refer to it as your day-to-day limit. But this is divided into subcategories. So you can, if you deplete the entirety of your 11,000 Rand limit, you have no benefit for the rest of the year when it comes to the benefits that's listed here. But if you don't deplete all of it, and you deplete, as an example, only your GP and specialist visit, but you still have money left of your 11,000, you can still use these. So just make sure that you understand how it works. You can deplete a specific benefit or your entire medical aid if it's your overall day-to-day benefit limit. So husband, wife, and 2 kids, you've got 5,240 Rand available for GPs and specialists. You have 3,500 Rand available for acute. So acute is basically just prescriptions and over-the-counter medicine. Make sure that you understand the rules of this. The over-the-counter medicine is limited to 590 per beneficiary and 2,300 per family. So that's almost like a sub-limit within a sub-limit. But make sure you've got that. And then if it's formulary medicine at a network pharmacy, you don't have the co-payments, but if it's non-formulary or non-network, you will have additional co-payments. 3,500 Rand for blood tests and x-rays, and then auxiliary services, you can read here what that is, but basically dietitians, speech therapist, occupational therapist, psychologist, things like that fall into auxiliary services, and then that's also at 3,500 Rand. You do get an additional benefit for CPAP machines and things like that, 8,500 Rand per family, so you have access to that. And then non-surgical procedures would be covered subject to the availability of overall day-to-day limits. So this is generally out of hospitals or something done in doctors' rooms. Alright, so let's dive into the rest. They give you a little bit of a safety net. So if you've reached your GP consultation limit or your GP and specialist limit, they give you one GP consultation for the family. So you have one, which is very cool, and then they also give you one specialist visit, but you must get a GP referral, so very important. You get 2 ER visits, and for the kids up to the age of 6, I always recommend a gap cover here. There's less fine print with the casualty visits on the gap cover side, and they allow kids up to a higher age for injuries, so very good benefit to have on the gap side, but it is covered on the medical scheme. MRI and CT scans, generous 15,000 Rand. That gives you a good 1, 2, maybe 3 scans depending on the type of scan. Again, a gap cover here will sort out that and will give you a little bit of a boost on your limit. The gap covers will also pay your co-payment, so make sure that if it's not a PMB, there's a 2,240 Rand co-payment. You do have 9,780 Rand for mental health conditions, so that's for psychologists or things like that to see out of hospital. That's per family, so that's a very, very cool one on Bonitas, which kind of makes them unique. They do cover some certain in-room procedures. Once every 2 years you can go for your glasses. This, in my opinion, is for the premium that you're paying, is quite a decent benefit for glasses, covering up to 660 Rand for a frame. If you use a network, then you'll have very little problems. If you don't use a network, you are capped to these prices or limits that I've highlighted over here. They do pay for contact lenses. Remember, this is once every 2 years, so use them sparingly, but it's very nice. And then in terms of dentistry, on this option, there's a lot of fine print on the dentistry, the teeth that are covered, which ones, so they primarily cover your front teeth and not necessarily your molars, but it is a nice benefit to have, especially for kids, for a lot of checkups and things like that. But just know 75%. So for every 100 Rand your dentist charges, you will have a 25 Rand co-payment. So just take note of that. They do pay for some of the x-rays, preventative, which is very nice. They do pay for fillings. Again, just take note of the rules. 1 tooth every 2nd year, so you cannot fill the same tooth more than once every 2 years. And then surgery in the dental chair, again covered at 75%, so make sure that you've got that. No in-hospital dentistry allowed. And but all in all, not a bad benefit for the price that you are paying for it. On this option, they cover the general 27 chronic conditions as required by law, so all medical schemes have to cover that, but Bonitas gives you one for free. Depression, any health conditions, or if it's listed as a chronic depression, you've got that, and they give you 165 Rand per month per beneficiary for that. International travel benefit. If you're a jet setter, 1.2 million rand per family. This used to be a little bit higher. It was 2.5 million. So if you travel often and this is not enough, make sure that you take out additional cover or choose a medical scheme option or a scheme that covers this for you at an adequate amount. So very cool. In 2025, you had a level 1 and level 2 of your benefit booster. They've done with that. This year, you just have to do your health assessment and a wellness screening at a pharmacy that's got an agreement with Bonitas. So that's all of your major pharmacies basically. And then they give you a generous 4,000 Rand benefit booster. So if we look at the top where you got 11,000 Rand for a husband, wife and 2 kids, if you add your 4,000 Rand, you've got a nice 15,000 Rand for day-to-day benefits, excluding that's you get your glasses and your dentistry over and above this, along with contraceptives and things like that. So very rich day-to-day option. Just make sure that you are happy with the way in which the structure works. There's a lot of mother and child care, so fairly decent maternity program. They've included antenatal classes, 1,000 Rand, so that's pretty cool. The antenatal consultations is alright. Some schemes offer 8, some 9, some 12, but 6 should get you at least halfway, so that's not too bad. And then they do cover these full consultations with a midwife after the delivery, so that's also nice. And then the 200 Rand for antenatal vitamins, so that's kind of cool as well. Just be aware that it's paid from your acute medicine benefit or your benefit booster, so, and it's subject to a formulary, so it's not an over and above, but you can allocate it. And why this is mentioned is vitamins are generally not covered with that benefit. So if you're not pregnant, you won't be able to get the Pregivites, but if you do have a bun in the oven, you can claim up to 200 Rand a month for that, so great benefit. They've got some cool things for kids, maternity program, someone that you can speak to if you're worried about something, a baby bag, some weekly check-ins for high-risk pregnancies and a post-birth checkup, so that's very nice. The childcare benefits also nice, pediatric visits. If the kids are born on Bonitas, so one in their first year and one in their second year. You can read a little bit up on that, pause the video and check it out if you want to know more. In hospital benefits, so it's important here to take note of, I'm going to skip a little bit, it's 100% option, so that means that you do need a gap cover because most doctors charge above the scheme rate or the Bonitas rate. This benefit is exactly the same in and out of hospital, so we've covered that. Make sure that you use a designated service provider on the cataract surgeries to avoid your co-payment. And then Bonitas, or most medical schemes actually, but Bonitas on this option specifically, they're not big fans of the dietitians and the occupational therapists and physiotherapists and things like that in hospital. So that will come from your day-to-day benefit, so do take note of that. And then your internal and external prosthesis, like a hip or a joint or a pacemaker or something like that, will be covered for PMBs only, in other words, life-threatening kind of situations or where you can lose the use of a limb. Mental health hospital, 38,000 Rand per family, so that's kind of a good benefit. 30% co-payment if you don't use the right network, so very important to make sure you've got that. They do give you your take-out medicine, so that's very nice. You've got cancer treatment, it's unlimited for PMBs, very important to take note of that. And then you've got 224,000 Rand per family for non-PMB cancers, and it's paid at 80% at a designated service provider. And then if it's a non-service provider, then there's no cover. So very important just to take note of that. The PET scans are PMBs only, as well as organ transplants. And then you can have a look at this. There are co-payments on this option. Pause the video here, have a look at that. If you're not a fan of co-payments, get in contact with us so that you can get a good gap cover. Ladies and gentlemen, that's it from me. If you've got any other questions, please reach out to us. You're welcome to give us a call at any time or send us an email, book an appointment, and we can discuss it in even more detail.